Thank you so much for being here.
Thank you for having me.
So, we do know that Hamlin is now, as we mentioned, breathing on his own and speaking. Is that a fairly big development for somebody who has undergone something like he has?
Oh, absolutely. This is huge. This means that he has turned around. The fact that he's off the breathing machine is huge. He's breathing on his own. And the most important part of it all, that was one of my concerns, is his neurological function. The fact that he's coherent and he's able to make sense of everything, that tells you that his brain function is intact. So, this is a very, very good thing.
And so we know Sunday they are going to play their next game. Obviously, he's not playing, but there is the possibility that he's going to watch it. As a doctor, would you advise him against watching the game altogether? Because there is a lot of excitement with that, and I don't know if that could impact any of what he is dealing with.
Certainly, it could be emotional, especially given what he just underwent. There will be some trauma associated with it. A lot of people undergo post traumatic stress disorder, PTSD, after having a cardiac arrest. So it may be difficult for him to watch the game, especially being absent. But it all depends on how he feels about it. I don't think it's advised against that he should not watch it. It all depends on his mental capacity at the moment.
So, a big news conference that was held yesterday where we learned a lot of this information about how he was doing. His progress overall seems to be better than I guess would first have been anticipated, but I guess it depends on how you look at it because every case is fairly different, I imagine.
It certainly is. In these types of situations after a cardiac arrest, our first and foremost concern is, are they going to survive? And the fact that they were able to bring him back, a pulse back, and the fact that he's off the ventilator, it tells a very positive story. I think we're out of the danger zone, so to speak, and now it's going to be a recovery phase. And the recovery to complete recovery may take some time.
And that's what I was going to ask next is how long could a recovery like this take? Again, we know that it's on a case by case basis. Every case is different, but are we talking a few months, possibly years?
It very well may be. When we give chest compressions, for example, that's a very aggressive resuscitation process. A lot of times we break bones, like ribs are broken. So that alone will take some time to heal. And then the cause, what actually caused that cardiac arrest, we still have yet to find out about that. And whatever the underlying cause was, that would need to be treated. So the entire recovery process may take months to a year. And whether he can go back to the field to play football again, that's an entirely different question. Only time will tell.
And another question here, could this have been prevented? I know that's a hard question to ask because every case, I keep saying it, is different, but is there anything that people can do to prevent going into cardiac arrest like this?
There are measures that could be taken, and in my professional opinion, they should be taken. There are some screening tests, very simple screening tests that could be done for athletes like football players. One is an EKG, and the other is an echocardiogram, which is an ultrasound of the heart. These two are very simple tests, but they can tell us a lot about their risks. For example, earlier in our interview, I mentioned there's something called hypertrophic cardiomyopathy, which classically presents as what we saw in this particular case. And that could have been detected, in any athlete just with a simple echocardiogram, and that could prevent a catastrophic event like this.
Do people who are playing contact sports like that, are they at a higher risk for cardiac arrest or situations like this?
For those who have pre-existing conditions like hypertrophic cardiomyopathy, yes, they are. They are at much higher risk of having cardiac arrest during contact sports or any kind of aggressive activity.
All right. Thank you so much for taking the time to talk to us here. A lot to discuss. Is there anything else that you do want to add before I let you go?
I just don't want people to panic. I think that this was an eye-opening experience for all of us. I think we ought to review the rules, and screening may need to be implemented for these athletes, because even if we can save one life, I think it's worth those screening tests.
Of course. Wise words there. Thank you again for taking the time to talk to us. I appreciate it.
Thank you for having me.